be talking about one of the most common modes that we use in the intensive care unit. And this is AC, DC ventilator mode, which is also called assist control, volume control. So the AC there is assist control and the VC there is volume control. So what does AC, VC mean? So the assist control means that the ventilator delivers a full mandatory breath. And this breath is given when based on a preset respiratory rate. So you set your respiratory rate. So based on that preset respiratory rate that you set, and of course, if patient also initiates a breath, then that ventilator will also deliver that full mandatory breath. So that's going to be the assist control. So every breath gets a full support, right? And then what type of support are they getting? So that now comes in with the volume control. So each delivered breath has a preset tidal volume. So it's tidal volume that you set. And that's the breath, that's how the breath will be delivered with volume. So for every breath that either the patient initiates or based on the rate that you set, then that patient will be getting that preset tidal volume that you set. So that means what is not fixed there is going to be the pressure. And that pressure will change based on the lung compliance, as we're going to see later, and the resistance. So let's now move on to what are the key settings in this AC, VC, in other words, in assist control, volume control. So first, you're going to set the tidal volume. And so that will be fixed. And based on our previous lecture, our tidal volume usually ranges between 6 to 860 mg per kg of ID body weight. And if you've not watched that lecture, make sure you watch that lecture so that you can know how we calculate the ID body weight. And of course, if somebody have ARDS, right, you may want to go lower than 6, right, depending on the patient, how severe the patient pathology is. Next, you're going to set your respiratory rate or mechanical rate, which is most of the time represented by F. You're going to set your FiO2 and PEEP. Like you mentioned in the past, both the tidal volume and the respiratory rates, those are going to help with what? Ventilation. And your FiO2 and your PEEP is going to help with oxygenation. So those are the key settings we're going to have on AC, BC. And what's not fixed or what's not set is going to be your what? Your pressure. So pressure is not fixed. And of course, if the compliance of the lung is really poor and you put in a lot of tidal volume, that could make the pressure to what? To go up. So a risk of higher pressures if compliance is poor. So let's now look how this works. So patient breathes, right? And the ventilator senses those efforts. And what's ventilator going to do? Because you already set your tidal volume, the ventilator will deliver a full preset tidal volume. And of course, if patient stop breathing, you already have your set rate, right? So the ventilator will still deliver breath at a set respiratory rate the rate that you already set, right? And this is just an image, of course, showing the assist control and volume control ventilator mode. So you can see what we set. So we set our tidal volume, our respiratory rate, our FiO2, and our PEEP. So for instance, let's say this patient is generating a respiratory rate of 24. So that means out of these 24, 16 of them are going to be what? Our set respiratory rates, right? So that's our set respiratory rates. And the rest of them is going to be patient initiated, right? So patient is one that is going to be initiating those breaths. But irregardless, either patient initiated or our set respiratory rate, patient is going to get a full tidal volume. So our full preset tidal volume that we set, which is going to be what? 500, guys.